ivermectin was recommended by a serious group of physicians in February of 2021, but they didn't want to do anything about it, and evidently they're so concerned about what that recommendation is and what their response is that they're willing to hide it from you, the American people. Now, Judicial Watch continues to push for information related to COVID, gain of function, the vaccines, the whole controversy around treatments, and I can't tell you the number of lawsuits. I don't know if I could track the number of lawsuits that we have about these various topics. But I do know that we've been able to get thousands of documents and pretty much everything anyone knows about gain of function and vaccine safety and efficacy and what we were doing in Wuhan is a result of Judicial Watch litigation and Freedom of Information Act research. And we have these new documents that just came out. I'm at CPAC here, so I got to use my phone. So we have this new spate of documents that came out about ivermectin and the recommendation by British experts to federal officials here in the United States that ivermectin be used as a treatment for COVID. Now, I don't know what they were recommending. Why? Because they're hiding the documents from us. And of course, they rejected that treatment protocol, and they're hiding the reasons about why they rejected that treatment protocol. This is where we stand. It's now 2 or 3 years into the COVID controversy, and there's still this debate about ivermectin. I know some people say it doesn't work. There are a lot of studies that say it doesn't work. There's some studies and others who swear by it. And so you would think there'd be keen efforts by the Biden administration to let the truth come out, that you had this group of experts recommend it, and that recommendation was rejected. And why was it rejected? We don't know, because the Biden administration is withholding the information from you, the American people. But we did at least get out, through our Freedom of Information Act lawsuit, details that show that they were put in a corner by this recommendation. We received 254 pages from the Department of Health and Human Services that included emails of then Director of National Institutes of Health, Francis Collins. So he was essentially Fauci's boss. NIH is an agency, and NIAID, which is the National Institutes of Allergic and Infectious Diseases, run by Fauci, is a sub-agency of NIH. So this group was sending emails not only to a bunch of leaders in the FDA, but it looks like the material then was sent on to other figures like Collins. So back in February 2021, a leading British physician, Dr. Tess Lowry, she was director and founder of a doctors organization called the British Ivermectin Recommendations Development Group. They call it BIRD for short. Emailed 31 top officials at the FDA with recommendations about ivermectin treatment for COVID. And what happened is these FDA folks then forwarded that material on to Fauci and Francis Collins at NIH. And they suggested, this BIRD group, that ivermectin be approved immediately for the prevention and treatment of COVID-19. The British Ivermectin Recommendation Development Panel recommends ivermectin for the prevention and treatment of COVID-19 to reduce morbidity and mortality associated with COVID-19 infection and to prevent COVID-19 infection among those of higher risk. And that was this was emphasized in the original document, at least parts of it. The steering group has taken the heed of the WHO statement, World Health Organization, on, quote, developing global norms for sharing data and results during public health emergencies, that states that public disclosure of information of relevance to public health emergencies should not be delayed, and also notes the very great risks that can occur from withholding data and results arising from analyses. We are therefore sharing this evidence to decision framework within just a few days of the BIRD meeting to avoid delay. Further, due to the urgency related to the communication and dissemination of this recommendation that is aimed at saving thousands of lives daily, please forgive the limitations of the draft proceedings document attached. Information on the process and methods can be found among the annexes. An executive summary is being finalized and will be available on Monday. So these folks were acting on an emergency basis. following standard protocols. If you've got a solution to a public health emergency, you should let the experts and those in responsible positions know as soon as they can. So this group had met, they had come to a consensus about the use of ivermectin. They rushed that material out to FDA, they rushed it to Fauci, and there it died. Now, of course, they did respond, and there's email trains showing there was a response to this emergency recommendation about ivermectin, but they've deleted that, or excuse me, they blacked it out, they've redacted it in the materials. It's entirely redacted. I guess we could show you the email showing how everything's blacked out, but you've got this emergency recommendation, they're hiding the details of it, and rather than act on it, or even, in my view, they should have shared the reasons they didn't buy into it with us, at least through this FOIA. They're hiding it from the American people. And as I say, rather than educate the public about the supposed reasons for their rejection of the ivermectin use recommendation, the FDA, NIH, and Fauci's former agency have blacked out their responses in these documents. So we've gotten this major success in highlighting how ivermectin was recommended by a serious group of physicians in February of 2021, but they didn't want to do anything about it, and it's evidently they're so concerned about what that recommendation is and what their response is that they're willing to hide it from you, the American people. Thanks for watching. Don't forget to hit that subscribe button and like our video down below.